Okay, so I want to talk about a client I worked with, an Iraqi woman with chronic pain. And I want to talk about it. I want to demonstrate how different ways of working somatically affect not just the experience of pain, but allows a reintegration or a re-emergence of a more integrated sense of self. And we know that in chronic pain and in trauma, there's a fragmentation or it can be a disintegration of that sense of self. And this manifested in a particular way with this client. And I want to do this in the context of recent research and thinking around chronic pain, and Tony's touched on that already, or actually more than touched, he's gone in quite some depth. And I want to reiterate as well that chronic, or that the pain, what we consider the pain signal, is a danger signal, an alarm signal. So it's demanding that we pay attention to it, that we do something about it. But we also know that pain is contextual. It depends on the meaning we place on it. It depends on the experience we've had. It depends on what happens around an injury and what happens after that. But it also depends on how we talk about pain and how we talk about an injury. So words matter. So I want to introduce you to... Something's happened to my slides. My slides have frozen out. Here we go. So I want to introduce you to Samira. So her name and her details have all been changed to maintain confidentiality. But she's a 40-year-old woman from Iraq of Chaldean ethnicity. And she arrived in Australia in 2012 via official UNHCR channels with her children, and her husband arrived later. I'm not sure the circumstances around that, but because of that timing, her and her children have permanent residency, and he has a temporary protection visa, or a TPV. And this is a genogram for Samia. So apart from her husband, she's got two sons who are in their 20s. So they were teenagers when they came out. And she's got a daughter who's 17, who's in a final year of school. But she's also got two brothers living in Sydney and a brother in Jordan as well. And her parents have now died, or have since died. And for those of us who work at STARTS, this will be familiar to us. So this is a way we try to capture the experience of our clients or of the refugee experience and the experience of our clients as they come from overseas. So it takes into account their journey, what happens around resettlement, so the introduction to a new culture, the learning of a new language, the normal life's challenges, which for Samia involved, there's financial hardship. There was a lot of stress dealing with government agencies. And I want to bring up here as well that one of her sons had an ongoing court case, which was going throughout our treatment, or pretty much throughout. And so she was having having to deal with a lot of police, a lot of courts, a lot of lawyers as part of this, which was really stressful. But also one of the things this characterization tries to capture is the positive factors or the protective factors that people have. And for Samia, they were quite significant. Not only did she have her family here in Sydney, but she had a big family in Iraq. And Tony mentioned about the previous experience can be protective, and this was certainly one of her protective factors. But she also the support of the Chaldean community and the Christian community. But she also had there are also internal factors at play here. One for her which proved really significant was a strong Christian faith. And even though she didn't engage in a lot of formal practices, there was this really strong faith. And I'll come back to that later. So she was referred to me due to the amount of pain that she was experiencing. And I've got a diagram here. And as you can tell, or as you can see, it was quite extensive. It was right down her spine, across her hips, the lower back, shoulders, neck. She had headaches. And she also had high blood pressure and was having trouble sleeping because of the pain as well. And when she came along, she brought scans from a couple of years previously that showed a disc herniation or a disc bulge at the base of her neck and in her lower back. But significantly, she didn't have any nerve compression or any other compression. And she'd also previously had a left shoulder reconstruction for rotator cuff tears and for pain. Unfortunately, it did nothing for her pain because, as Tony has just been talking about, pain is more than just the physical injury. But she was very fixated and very focused on the fact that her discs and her shoulder were what were causing her the pain. Now, when I examined her, what I found was a huge amount of tension throughout her neck, her shoulders, her spine and her ribs, and also through the fascia of her chest and down into her diaphragm. But it was more than just tension. There was this real sense of compression, of something being sucked in. And there was a real binding of the tissues. So it was really hard to discern between the layers of the tissues, be that between the skin and the fascia and the muscle and the fascia. It was all compressed and bound. But what was curious as we spoke was that she considered herself to be the glue of the family. She was the one that kept everything together. And she took this felt like she took the weight of this responsibility very seriously and really felt as though she was holding everything together against the forces that were pulling the family apart. And these were very real forces. One of her sons might end up in jail. Another one, like her children were becoming more integrated into Australian life and were pulling away from the culture and also from the family as that happened. So this was a way in which, this was reflected in how she was organising in her tissues. So it's quite a potent metaphor. She also described herself as being depressed and was actually on SSRI antidepressants. So she had she had quite a flat effect, not a very flat effect, but she did have a flat effect. And she said she didn't feel anything. Now, part of this may have been the antidepressants, but also with that degree of boundness there, she wasn't able to feel very much. There was no sense of emotional flow through her body. And my sense of her was of someone who was very prickly. So I almost felt dared to take her on. And there was a real dilemma in this because here she was coming to me to help with the pain. And at the same time, this sense of, go on, I dare you. So I realized that I had to be really respectful of the pace at which she could move and be mindful of how much that I actually did. But in spite of this, she did make eye contact and was well dressed. So our therapeutic goals were, at its most basic, was to address the pain. We weren't sure how we were going to do that, but it was obvious to both of us that it was influenced by more than the herniated discs, by more than the injury or the local inflammation. And we knew that because she was able to recognise that the pain went up and down as depending on her emotional and psychological states. And how we wanted to do that was to try and reduce the tension and facilitate more responsiveness in her tissues. So I wanted to get a little bit of movement, or start off by reducing the tone, getting her to let go of some of the tension and to get more movement. And I also wanted her to be able to notice what was happening in her body. So as we got more movement, what did that feel like? I wanted her to be able to notice sensations and feelings other than pain. So she was very focused on the pain, as Tony was saying, but also focused on the cause of the pain. And that focus proved very sticky. Now, it was really hard to draw her attention away from that. And as I was reflecting on this, it kind of makes sense because that's the nature of focus. It separates and it isolates so that we can see that very clearly. Unfortunately, what she was seeing was the pain. And so that can be voluntary or it can be a consequence of what's happening neurologically, such as where there's an alarm signal, as Tony said, or a pain. So what I wanted to create were the conditions in which that focus was able to be disrupted. And so I wanted to create a sense of safety, amongst other things, because I wanted her to be able to start to notice more than just the pain. So I also wanted to hold and support her in a way that didn't deprive her of the resources, that didn't deprive her of what she knew worked. So I wanted to give her a sense, especially as things like the court case played out. So what I wanted to do was give her a sense that someone else was there, or that something else was there, and helping her hold and helping to support. Because what I trusted was that this would allow some of the compression to reduce and give us more options in how we worked as we were able to notice more. But ultimately, I wanted her to be able to move more, so physically, emotionally, cognitively, and creatively. And these aren't separate. As one starts to shift, they all start to shift. And also keeping in mind that what can look like no movement from the outside or very little movement can look like it can feel like a huge amount of movement on the inside. So how we did this was she received 27 sessions of somatic work over a 9-month period. And this was based on the principles of orthobionomy. Now, in orthobionomy, what we're looking for in our clients is where they're resourced. So I want to know, where are they able to move? Where are they able to respond? Where are they able to let down? And I want to support that. And I'll say a bit more about that later. 2 years previously, she'd received 15 sessions. And it was in the midst of this that her son got in a strife with the police. And amongst all that, there was too much going on. So in discussions with the psychologist, myself, and with Samia, we agreed that we wouldn't continue for now, but she could come back later. And here she was. In the interim, she'd had some neurofeedback to help with the pain, which hadn't been that effective. She'd also been to the local pain clinic and had had the shoulder surgery and had some physiotherapy as well. None of that had been really that effective. I worked in collaboration with a psychologist, and we also had an interpreter throughout that, a female interpreter, though it wasn't the same interpreter the whole time, but she continually changed. So how do we do this? Initially, it was through assessing her pain. So what made it better, what made it worse, her understanding of the pain, and also what the causes were, what she saw as the causes. And it was clear to us that she needed a bigger framework. So there was some education at the front about the nature of pain, about what contributes to pain as well. And we needed to find a way to work that supported her tissues and her structures, because if you tried to do too much, she would revolt. So if I worked too fast, if I worked too hard, if my attention or my intention became too focused, then there'd be a retraction in the tissues. Or if I was working on a shoulder, her neck would get tight. Or if we're working with the neck, her headaches would get worse. So she wasn't always aware of this. And she said, no, what you're doing is fine. But I was able to tell the body was saying, no, mate, it's not. And if she became too self-conscious, this would also happen. Now, how we supported the tissues and how we do that in orthobionomy is by mimicking what the body's doing, or that's one of the ways. So if there's a contraction in the muscles, what we'll do is gradually exaggerate that contraction in order to feel where does the softening occur? Where's the point at which there's maximum softening? Where's the point at which there's maximum comfort? So throughout this, I was checking out with Samia, what are you noticing? Does this feel comfortable? Is this relieving the pain? What's happening with the pain? So is this to and fro between us throughout? So she was engaged in this process. And what I wanted to notice was, when I do this, what happens next? What is the body able to take the next step? Is there a reduction in the tension? Is there more discernment between the tissues? Are other structures also starting to soften? is there a more coherent organisation in the tissues? And is there more movement available in the structures? So what we're doing was working with and encouraging more flexibility in the autonomic or the reflexive responses in the tissues and the structures. And this is the stuff that bubbles along in the background that we're generally not aware of, but informs how we're experiencing ourselves and how we feel about ourselves, but also informs how we feel about the world around us. So again, I wanted her to notice this. I wanted to help her to notice her internal sensation and to build her capacity for that. I wanted her to notice what was happening other than the pain. Could she feel the movement? And this wasn't a cognitive process. This, if we try to think about that, we tend to lose it. So something that she had to be aware of and notice. But we also had to include any emotional or mood changes as they occurred. So we didn't go looking for these, but as the body shifts and change, this is an inevitability. And there's a description of emotions that I really liked and which really resonated from Daniel Siegel, in which he said, and I'll read this out, that the emotions can be viewed as a process involving the linkage of separate things to one another. So as an emotion or a mood rises up, and this is my experience as well, it pervades everything and brings them together, but it also allows them to be discrete within that relationship, which also suggests a connection in that interpersonal relationship as well. And we didn't always work with mood directly by bringing attention to it, though sometimes we did. It was more in how we engage with it. So it was in the voice, in the prosody, in the volume, in the speed of speech, how playful it was, how we danced with the energetic component of that, how we dance with the energetic component of that, how we move together in that as well. Which brings me to the interpersonal. And as I said, I was aware that, I'm aware that I would become part of the dynamic. And that was clear from the outset when I said that I felt dared to take her on. And this is important because I knew that how I responded to what I felt in the tissues and how I responded to her at a more interpersonal level would influence what happened next and potentially change or reinforce the dynamics around how a tissue is organised, but also around her expectations within the interpersonal space organised as well. So I had to be mindful about where I sat in myself. I've already said that if my intention became too focused, that she would recoil. But also if I got drawn in too much, that I would get sucked into her sense of compression, her sense that nothing can change here, and a sense of hopelessness that pervaded that as well. So I had to be really mindful about where I sat in myself, and that helped to inform the dynamic as well. So what happened? Man, for about 10 weeks, it felt like nothing much was happening at all. It was very hard for her to notice any changes. So she generally did feel better after the session. So she would say that the pain was reduced, she could move more, and she felt calmer. But that wouldn't really last very long. It would last until she got out of the door. It would last until she got home. And this didn't really change, as I said, for about 10 weeks. But in that time, what I started to notice was that her tissues were becoming more responsive. When she got back up on the table after the previous week, she'd be saying, oh, my pain, my neck, it's the discs, it's the shoulder. And then, but as I started to work with the shoulder or the neck, the tissues it was almost as if they were remembering what had happened the week before and were saying, I remember this, and starting to respond. And also I noticed that responsiveness was starting to carry over successive weeks. And gradually what happened was she was able to notice more of what was happening in the tissues, and significantly she was able to trust that. And as she trusted that and was able to feel more, she actually started to feel more. So then when we were chatting, she'd talk about her life, she'd talk about her family with more effective quality and more feeling. And as this became stronger, this is when things really started to change. And another example of this was when she first came in, and I'd say, "Hi, Samia, how are you?" And she'd answer with, "Alhamdulillah," or "Praise be to God, thanks to God." But there was a real sense of resignation in that. And when she talked about how she prayed, and when she talked about praying, there was always also this sense of resignation. And gradually, and I noticed that this started to change. It wasn't gradually, actually. And when she started to talk about praying, there was this growing expectation that it was going to have an effect, that there was going to be a response, that there was going to be something coming back. And there was almost a sense of a growing relationship in that, and less of a sense of this was all a punishment, which was how I interpreted, at least, how she was, that sense of resignation and that sense that nothing was going to come back, and that was tied in with the pain. And several key events happened which helped to reinforce the work we were doing and gave that a big boost, actually, and helped to integrate that. And the first was that her son's charges were withdrawn after multiple attempts at prosecution. And this had been going on for about 2.5, 3 years. And every time it came to court, they asked for an adjournment to get more, gather more evidence. And so to be adjourned for 3 months, adjourned for 6 months. And then finally, there was this court case where they withdrew the charges and her son was free. And she came in and quite impassively told me this. And it was like, are you relieved? And she said, "Of course, yes." And she let out a deep sigh. And we spent the rest of that session exploring how that felt and how that felt in her body, the changes in her tissues. And there were significant changes. But also as she spoke and she got angry at the police, angry at the process, we were able to notice the changes in the tissues that came with the anger. I mean, for starters, she was able to contain that anger and feel that and not have to recoil from it. And we were able to notice the movement between the anger and the relief, what happened in the tissues with that, which was quite significant for her. And then we worked with that for 2 or 3 weeks until this second event happened, which was about a month after her son's charges were dropped, where there were the protests in Iraq. And they were the protests in which the young men were coming out and protesting about the lack of prospects, about the lack of jobs, that the government wasn't doing enough for them. And the militia and the security forces opened fire into the crowd. And she was deeply affected and saddened by this. One reason, because of what was happening to her country, and two, because this could have been her son's. But what was significant is that she was able to feel this, and she was able to feel the depth of this. And one of the things that helped her to do this was the strength of her prayer. And she was able to start praying strongly with a lot of heart, with a lot of feeling. And it was almost she needed something much more or much bigger than us, actually, to help to contain this depth of feeling that she was experiencing. And she was able to actually feel that as well. I'm sure that helped to contain this. And this was also deeply integrative, as I said before, and really gave her a sense of herself, her relationship to the world, and to her relationship to things that were bigger than her. And in a more kind of banal way, but in a really important way, she also went for a citizenship, which she passed on a second attempt with her children, and she was accepted as a citizen. And this was tempered by the fact her husband wasn't able to do this because he was on a TPV, but this was something she was really proud of because her English wasn't great, and she got through the test, and she was now going to be accepted as a citizen of the country. And it's something she was really proud of. Which brings me to And I'm aware we haven't spoken much about the pain. And the therapeutic aim, the first one was to work with the pain. So what happened with that? So the pain persisted. The pain didn't actually go away, but the severity of it and the debilitating nature of it decreased. So she was much more aware of the pain as another sensation. And when it increased, she had more capacity to work with it with a wider understanding. And this was also built on the kind of more somatic work that we'd done. It gave her a direct experience of what that was like. She was also more motivated to do the self-care exercises that were given to her because she'd had an experience that they worked and she valued them and she trusted them. And soon after she got the citizenship, we stopped working. But I was trying to encourage her to get more rehabilitative work with someone who knows how to work with chronic pain as a way of strengthening her, improving her function, but also now that she had more sense of self, now that she had more capacity to work more robustly, that some stronger work may be really beneficial for her. But her capacity to function had improved and a sense of aliveness increased. And I just want to finish off with, I found out after she left that I'd said before about trying to keep her family together. And I found out after she left that actually one of her sons moved to Newcastle for work. And the other son had a girlfriend with someone that she didn't really like, but that she was accepting of the fact that he had a girlfriend, which also, given that she had been trying to hold things together, this was a really nice postscript to the work that we'd done. And that's probably where we should end. So thank you.